So, welcome to our debate. Our topic was the right to exercise personal liberties versus the need for habilitation. So, our presenters for this debate is Krista, which she is on the pro of personal liberties. Then we have Ken, who is also on the pro for personal liberties. Then we have Rocio, who is me, on the con and for the need for habilitation. And then we have Salwa, who's also on the con side and in need for habilitation.
So while the necessity for individuals with disabilities to receive treatment and habilitation exist, all people have personal and individual rights that are protected by the Constitution and various amendments and legislative acts within. The purpose of this debate is to highlight the arguments and conflicts between those who believe habilitation and intervention is a social requirement and those who believe that personal choice and liberties supersede those needs. All citizens have guaranteed rights under the Constitution. Those citizens who have disabilities are no different and are supposed to be treated equally. For those individuals with disabilities, the choice should be given for what type of treatment they are going to receive and what goals are going to be set for them. They should be able to have as much choice as their abilities allow them to. Individuals with disabilities should be given the right to deny any services that they do not agree with and deny any goals that they do not want to work towards. It is every individual's right to do so, as individuals with disabilities are to be treated no differently than those who do not have disabilities. Again, personal liberties are guaranteed by the Constitution. When appropriate, individuals have either direct control over their finances or are to be permitted to choose who will control their financial agreements on their behalf. Individuals with disabilities should be given the choice to choose how they live their life, given that they have the ability to do so. Freedom of choice should allow individuals with disability to choose goals to work on that make them happy while promoting independence through the freedom of choice. BCBAs and other individuals working with the individual should be working towards the same goal. We can all agree that the goal of treatment is to be effectively promoted to gain independence through the use of applied behavior analysis for the individuals receiving therapy. But what if the goals of the individual and those of the BCBA are different? The individual should be able to have the choice to pick what goals they are happy with and want to do. It is counterproductive and unethical to force an individual towards a goal that they do not want to work on. Ethically, working towards a goal the individual does not go against, that working towards a goal that the individual does not want to goes against the Behavior Analysis Certification Board Professional and Ethical Compliance Codes for BCBAs, specifically Code 2.0, that states that behavior analysis has a responsibility to work towards the interests of the client being the individual with disabilities.
One particular study that we found pretty interesting was called Negotiating Learner Autonomy. And this case dealt with a young girl named Alice. She, I believe, was in Norway, and she was diagnosed with high functioning autism at a very young age. In school, the people that worked with her and worked on her behalf noticed that she seemed very interested in systems, sciences, and organizational matters. But her teachers believed that she didn't have the capacity to learn those things or to maintain those skills once she left school. And this was possibly false information that they had. It could have been true, but they didn't give her the opportunity to choose what she wanted to learn. They kind of relegated her to smaller tasks, easier tasks, and because of this, she was always held at a lower standard than her neurotypical peers. Um, because of this, also we don't know now whether or not Alice could have ever, you know, broken that mold. whether or not she may have been able to complete those tasks, had generalized skills, maintenance skills after she got out of the course, because she was never allowed the opportunity to learn the things that she wanted to do. And this speaks, I think, a lot to the idea of learner autonomy when it comes to children in schools.
So this image is an image that was created based on the needs of every individual, regardless of having a disability or not. So there's 4 levels on this chart. The bottom 4 levels are based on deficits. The top is based on needs and motivation towards self-actualization. So each level has to be met for the individual to go to the next level, such as the need for water has to be met before the need for safety is met. Another example is with the friendship and intimate relationships, that if you're an individual with disabilities and you're not a part of your treatment plan and someone is coming up with goals for you to work towards, they need to look at a chart like this to determine what goals to work on as the individual being an individual and not seeing them as needing to fulfill something in society to learn how to do something that doesn't meet their needs to reach their full potential. The top level is a need for growth. And this does not stem from a deficit, but rather a motivation to grow as a person. So in order to grow as a person, all of the other 4 needs have to be met. So when a BCBA is working with an individual, they should give the individual the choice to choose what they want to work on so that they can eventually reach their fullest potential. This is a chart based on ages. So we have childhood, young adult, middle adult, late adult. And then each of those needs are categorized based on the time needed to satisfy each need to then move on to the next. Something like this should be taken into consideration when basing goals for individuals to understand how to move them from a basic need of getting water, eating, warmth, to then moving on to other needs to reach that fullest potential. So, for example, in childhood, safety is very low. The time spent on a safety goal shouldn't be as long as an esteem goal, such as also in a young adult, think of a middle school student needs to spend a lot of time on many activities that, let's say, an elementary school child wouldn't. So something like this chart should be taken into consideration, and the individual should be able to view research on things like this to base their own goals on, and what goals are ultimately going to make them happy and they want to work towards. Again, because ethically, you cannot work towards a goal that the individual does not want to work on.
So, what is habilitation? Habilitation refers to a process aimed at helping disabled people attain, keep, or improve skills and functioning for daily living. Its service includes physical, occupational, and speech language therapy, various treatments related to pain management, and audiology, other services that are offered in both hospital and outpatient locations. So, Krista, go back. There we go. So for this slide, freedom to choose may interfere with learning skills that promote independent living. For example, as Krista said in one of her slides in the back, BCBAs and clients might not always have the same goal, agree on the same goals to work with. Sometimes clients will choose not to work on a goal that they don't like or they don't want to participate in or something like that. And that can be a conflict, especially if the client is of age to be learning that goal. For example, an 8-year-old boy who is in need of learning how to put on his pants. Maybe the boy doesn't want to put on his pants by himself and chooses not to engage in that goal. It causes a conflict because then they're not learning important living skills. Putting on your pants, brushing your teeth, um, folding clothes, those are all important living skills to do as you get older. So because we're not engaging in these skills anymore, that means that the clients are at risk for being, how would I say this, being dependent on someone for a long period of time. Um, Giving clients the freedom to choose may hinder their acquisition in critical independent living skills. And that's a problem too with federal, state, and local funding is that when they are able to take away the program, if they feel that the child or the adult or whatever isn't learning independent living skills, because that's the whole purpose. The whole purpose is to give the client or child or adult resources so that the treatment fades and that they are able to move on in life having those skills in the future. So,
Okay.
there we go. Persons with severe handicap who would make poor choices that might well jeopardize their safety and well-being of themselves and others. For example, individuals that engage in self-injurious behaviors might choose to engage in those behaviors because it's self-stimulating, it's how they cope, they like to, and sometimes that's dangerous. They can choose to, for example, bang their head against the wall over and over again. Everyone knows that that's dangerous. They can cause an injury, they can cause severe head trauma, and it's not safe. So treatment is brought in to get that individual to stop or to engage less in self-injurious behaviors. But if they're giving the choice of, well, do you want to work on this goal or not, they might say no because they enjoy banging their head on the wall. That's an issue because it's putting their life at risk and harm. And ethically, that's not something we should be allowing, letting them risk their life and putting them at risk of harm. Um, Without the need for habilitation, individuals with disabilities will have difficulty working, going to school, or participating in other activities. This means that in school they might be get held back for not being able to sit and attend for a certain amount of time. Um, Working, they might not be able to follow directions from step 1 to step 10. So then that gives them the having to depend on other people to do basic things for themselves that they should have been learning at a younger age. So, what's the opposite of habilitation? You have disadvantage, unfortunately, weakness, inadequacy, incompetence. So, habilitation should be taken into consideration as well.
Okay. People who oppose the right to choice for people with disabilities, arguing that the majority of people with developmental disability are highly susceptible to making bad choices. This basis for this particular reasoning is that people who lack a range of skills and don't have a clear understanding of the outcomes of their behavior, usually evident among people with disabilities, need intensive and thorough teaching before being allowed to independently choose their preferred areas. Until they gain the acquired skills, the responsibility of decision making lies in the hands of parents, guardians, and teachers. Okay. Um, Another arguing that challenge the act of granting person with disability the ability to choose, in that allowing this kind of freedom may interfere in their acquisition of important living skills. Due to this particular reason, the federal, state, and local funding agencies shows an appealing interest in teaching skills that facilitate independent living to individuals with developmental disabilities, since they are dependents, thereby require substantial financial support from the public. Um, 1 second. Okay. This argument therefore implies that violating personal liberties with the aim of teaching independent living skills is an act of achieving a greater good at the expense of small bad. Some scholars also argue that clients are obliged to achieve goals as set by interdisciplinary planning process. Okay, denying the right to choose may speed up the decision process and assure better choice. However, such an approach may limit the development of a patient's skills in making good choices. While we expect the cooperation of parents, guardians, or teachers, it is important to continue to take some risk in advancing the patient's skills of making better choices by letting them be involved in this process from the beginning. While some independent skills, this,
Crystal, go back.
okay. While some independent skills can be quickly acquired by the patient, we believe that constitutional violation of personal liberty far outweigh such an acquisition. Furthermore, the ability to make good choices will be significantly limited.
Just some extra points before Chris's wrap up, trying to summarize the pro personal freedom side. As she said, the U.S. Constitution guarantees the rights and liberties of everybody that lives within the country. The Americans with Disabilities Act, which was in the 1990s, did much the same thing the Civil Liberties Act in the 60s did, and it allows people with disabilities to be legally free from discrimination. A lot of states have their own individual mandates for this as well. And we know that in any situation, too much restriction is a violation of rights and personal freedoms. In the case of children, obviously there's always some restrictions. I think that individuals, children that have developmental disabilities, should have similar restrictions as their neurotypical peers, not much more. And in the case of adults, they should be allowed as much liberty and independence as absolutely possible. There are, of course, instances where physical restrictions for severe cases like self-injury or harm to others are required, but these should always be avoided whenever possible. A lot of research has shown that independence is very important for personal growth and development starting at a young age. And the more restricting and structured a daily intervention plan or treatment is, the more that it can hinder those independent kind of lessons to be learned. And like was stated in the case study that we referenced earlier, choice in instruction for children is very important. They tend to show more interest in things that they choose. The results are usually better on tests, and you see better generalization and maintenance of these skills post-intervention. And there's also some evidence that integration with neurotypical peers and their classmates increases their social skills, which is definitely something that is needs to be maintained afterwards as well. Increases their independence. There are several ABA ethics codes that reference the rights for a client to have the absolute most least restrictive treatments, and a lot of those apply here. Many of those codes actually run parallel with laws regarding civil rights. Like I said, in the case of children, it can be complicated. There's sometimes a lot of input, different sources of recommendations and instruction. This can be parents, caregivers, teachers, therapists, even local governments, depending on the school system or the state that the child is in. All of these can be involved, and all of these differing demands, differing restrictions, and suggestions can cause a lot of confusion, not only for the child, but also just in terms of getting a treatment plan situated. And this certainly can delay results and affect results of the treatment negatively. Um, in the case of adults, the conversation can even be more complex, even more complicated. There's a lot of other factors to consider when it comes to civil liberties and freedoms with adults, especially if they're still receiving some kind of services. Unless an adult is completely dependent, as in the case of only the lowest functioning individuals, as much personal autonomy as possible should certainly be allowed. I think that the biggest, most important considerations for adults when it comes to personal liberties is things like their residential placements and their financial freedoms. Um, if an adult is able to live independently, they should obviously be able to choose their living arrangements. But if they're lower functioning or if they're still receiving services and require home care, they should still have input in these decisions within reason. Of course, individuals should be able to choose residential placements if they're not living at homes by themselves. They should be able to have some input in the care facility that they're staying at. And this allows them to have some sense of individualism, autonomy. It also gives them autonomy over their surroundings, their direct environment, sometimes the staff that's working with them, or their caregivers that work at the facilities with them. And if they're receiving treatment or if they have caregivers at home and they live at home and just have kind of in-home care, they can choose family members to live in with, or they can, have a say in which caregivers are giving them their daily care. When it comes to things like finances and resources, unless they're completely unable to handle those responsibilities, they should have as much control over their finances, their money, their resources as possible. If it's a case where a caregiver or maybe a power of attorney is handling the financials, the individual should definitely at least be able to choose who these people are, have a say in who's going to be making these decisions on their behalf. With finances especially, they should be either notified of all transactions that are being made on their behalf or approve of all of them beforehand. And without the autonomy to make these kinds of choices, there's certainly the potential risk for abuse. There's risk that the individual could be abused financially or physically by caregivers if the right people aren't chosen. They can be neglected if the right people aren't chosen, and they can certainly be taken advantage of. We've seen that quite a few times where caregivers are chosen poorly. The individual has no input on who takes care of them at home or who's taking care of their finances, and that person ends up abusing that power by either physically abusing or neglecting them or stealing their money, using their money for things that they don't want them to. So there's quite a few different reasons why even people that require some kind of care should always have as much autonomy in these decisions as possible.
I would like to wrap up a point on promoting independence through the freedom of choice. For the example of an individual learning how to put on their pants is very important. You could give someone the freedom of choice of two goals. One is putting on pants with Velcro. One is putting on pants with a zipper and a button. Once they do Velcro, then they can do the zipper and button. There's always the freedom of choice, not just this is what you're doing. So freedom of choice can be given like that, as in two different options. And of course, as Ken also said, personal liberties are guaranteed by the Constitution. Regardless of disabilities, people should be guaranteed their constitutional rights.
Personal liberties can be perceived as compromised if that habilitation service providers may teach behaviors that may not be in the line with the client's preference. However, this could be on the long run beneficial for such an incapacitated individual. Staff members, like parents or guardians, may, for instance, choose to teach jogging without seeking the client's consent on the particular activity. This may result in health improvement, even though the individual may choose not to participate for lack of full awareness of jogging benefits. Doing this means disagree. No, doing this means disregard of the interest of client. While this may compromise personal liberties, since clients are sometimes incapable of making a choice in their best interest. The risk of making such choices can put them at a great risk. Generally, whether or not give the individual the right to choose has been a debatable issue among the community. That's how it would always be, like a debatable issue.
So, while there is a need for habilitation, personal liberties should be taken into consideration, of course, but to an extent. Sometimes their choice doesn't always agree to for what they need. And sometimes, in order to get services, the state or legislature within wherever they live requires that they get some living skills or have a requirement on what type of skills they should be learning. And if they don't, then that the state has the right to remove financial aid from insurance, and then the client or person is without any help and needs more services but doesn't have the insurance or the financial aid coming in. So it is important to take personal liberties into consideration, yes, but the need for habilitation is also important as well.
Right, and then I'm just going to show everyone our references.